Everybody, my name is Joseph Athanasio, and I'm going to be talking to you today about asbestos and lung cancer and the relationship that I found when I was writing my paper and compiling this slideshow. First, let's talk about asbestos. It's a fibrous, fire-resistant mineral. When airborne crystals are inhaled, they become embedded in lung tissue, causing health issues like lung cancer and mesothelioma. The crystals have either a serpentine shape, like in chrysotile, or an elongated, sharp needle-like shape, like in the amphibole group, which has a few different kinds of asbestos in it. The methodology for the research that I looked at when I was writing this, most of which talking about the relationship between asbestos and lung cancer are just synthesized reviews of literature. So they're looking at data and statistics and trying to draw a conclusion from those. Almost all the rest of the papers involve patients being interviewed and or scanned to determine their exposure to asbestos and draw conclusions from that. So the first kind of research that we're looking at is a literature review, which is the majority of the kind of research that's available. They are going to be normal research papers or meta-analyses, which is a compilation of research papers, the results of which are looked at and weighted and then published as a total. And so overall trends can be looked at and try to be discerned. These are both research papers and meta-analyses are published on PubMed and NIOSH 2, which are online resources that are very good to look at if you're trying to find information like this. They're going to be cross-sectional, case control, and cohort studies. Those are the three kinds of observational studies. They're a little bit different. A cross-sectional study looks at present exposure and disease prevalence. A case control study looks at past exposure and present disease prevalence, and a cohort study looks at present exposure and then follows those individuals into the future to look at their future disease development. And they're going to be looking at case reports and case series. A case report is a report of the diagnosis, treatment, and response to the treatment of a patient. And a case series is just going to be a group of case reports. Specifically, I looked at Klebe et al., and they found that there is a synergistic interaction between asbestos and tobacco smoke in the causation of lung cancer. So what that means, let's say exposure to asbestos may increase someone's likelihood of developing lung cancer by 5%, and their exposure to tobacco smoke may increase their likelihood 10%. If someone's exposed to both, the result will not be a 15% increase in the likelihood of them developing lung cancer. It'll be 25, 30, or even greater percentage. And that's why it's called a synergistic interaction. Moving on to Lemen and Landrigan in 2021, they looked at the data they could find on sailors and found that they have a standardized infection ratio between 1.10 and 1.62. Sailors are an exposed group when it comes to asbestos. Moving on to Huan et al. In 2013, they found from the 13 cohort studies out of 15 that they looked at that occupational lung cancer risk increased in workers with asbestos exposure with an SMR between 1.6 and 6.52. So an SMR is a standardized mortality ratio that is just going to compare the prevalence of death from a disease in a group to the general population, similar to the standardized infection ratio, which just looks at the prevalence of the disease, not the death therefrom. But the ranges that we're looking at is 1.1 to 1.62 for the standardized infection ratio of sailors and 1.6 to 6.52 in occupational exposed workers. The disparity can be attributed to a few things. It could just be random. It could be that asbestos exposure involved lung cancer is a more deadly version than other kinds. So more often patients are going to die from that, or it could just be that sailors are not as thoroughly exposed to asbestos as your normal occupational worker, even though they live 24 hours a day, 7 days a week in a ship, which is constantly going over waves and deforming and causing asbestos to be airborne through um, from between walls and around valves and gaskets and machinery, where it was used as insulation or fire prevention. Of course, we can't know why this discrepancy exists until more research is done. The other kind of research that I looked at involved interviews and scans. Interviews, just asking someone about their exposure to asbestos or tobacco smoke. Of course, it's important to look at both, because if you don't isolate those variables, there can be a lot of noise that gets introduced into the data, and you are not quite sure what you're measuring. The other way of determining someone's exposure and the burden that asbestos compiles on them is through electron microscopy. Those scans measure millions of fibers per dry gram of lung tissue, and it also tells you the fiber type that's prevalent in that lung tissue. And of course, both of these are going to be important to discern if there's a dose-response relationship between asbestos exposure and lung cancer. First of all, to look at He et al. In 2021, they found a dose-response relationship with lung cancer and asbestos, and a latency period between exposure and diagnosis. So as you might expect, the dose-response relationship just means that the more asbestos you are exposed to, the more increased the risk of lung cancer gets. And the latency period just means that you're not going to get lung cancer immediately from being exposed to asbestos. There's a period that it takes to develop over a decade. Additionally, Gilham in 2016 used electron microscopy to find more amphibole fibers than chrysotile fibers. This is interesting because during the time of the workers that they measured, the vast majority of asbestos that was imported to the US and the UK, where they did this measurement, the vast majority were chrysotile fiber type asbestos. The reason for this is that chrysotile has a half-life in human lungs of just a few months, and amphibole fibers, though much less used in the industries, have a half-life. The lowest is 6 to 10 years for some types of amphiboles, and up to 20 years for others, like crocodilite. Now, in conclusion, we learned that asbestos exposure does incite a dose-response relationship with lung cancer after a latency period. Asbestos alongside tobacco smoke has a synergistic effect when it comes to causing cancer. And the data shows that different asbestos fiber types dissipate from the lungs slower than others and are therefore more dangerous, because they stick around and are given a longer opportunity to cause lung cancer in individuals. That's all that I have for you today. Thank you for watching, and let me know what you thought down below. Thank you. Bye.